Good day, everyone. For today's week, we are going to discuss the first tier of our infection control precaution, which is standard precaution. When we talk about standard precaution, this is previously known as your universal precaution. Your standard precaution, these are minimum infection prevention practices that apply to all patient care. Regardless of suspected or confirmed infection status of the patient, in any setting where both healthcare is delivered, you need to apply your standard precaution. And your standard precaution is based on a risk assessment, depending on the possible exposure that you will be encountering to your patient. And it makes use of common sense practices and personal protective equipment. There are many components of your standard precaution. Number one on our list is we have your hand hygiene. We'll just have a quick review regarding hand hygiene because we will have a separate topic regarding this component. Now, during the delivery of healthcare workers should avoid unnecessary touching of surfaces near the patient to prevent both contamination of clean hands from environmental surfaces and transmission of pathogens from contaminated hands to surfaces. Hand washing with either a non-antimicrobial soap and water or an antimicrobial soap and water is very important, especially if your hands is visibly dirty, contaminated with proteinaceous material, or visibly soiled with blood or body fluids. Now, as what I have mentioned, especially during orientation, the gold standard of our hand hygiene is we have your decontamination of our hands with the use of alcohol-based hand rub. Now, always remember, guys, to perform hand hygiene in the following clinical situation, like before direct contact with the patients, after contact with blood, body fluids, or excretions, mucous membranes, non-intact skin, or wound dressing, after contact with patients in intact skin, like when you are going to take pulse, or blood pressure, or lifting a patient, if hands will be moving from a contaminated body site to a clean body site during patient care, after contact with inanimate objects, including your medical equipment, in the immediate vicinity of the patient, after removing gloves. So this is very important because there are some healthcare workers, especially during my rounds, when I am having my hand hygiene observation, there are some healthcare workers who are not doing hand hygiene after removing their gloves. Next one is wash hands with non-antimicrobial soap and water or with antimicrobial soap and water if contact with spores like Clostridium difficile or Bacillus anthracis. The physical action of washing and rinsing hands under such circumstances is recommended because alcohols, chlorhexidine, iodophors, and other antiseptic agents have poor activity against spores. Then last one is all healthcare workers should not wear artificial fingernails or extenders if duties include direct contact with the patient at high risk for infection and associated adverse outcomes, especially those who are in ICUs or operating rooms. The next component is we have your personal protective equipment or your PPE. Your PPE is based on your risk assessment, like depending on the nature of the anticipated patient interaction, indicates that contact with blood or body fluids may occur. So it depends on your risk assessment or possible exposure to certain patient care activities on which type of PPE that you're going to wear. And if we are going to remove our PPE, we need to avoid contaminating our clothes and skin when we are going to doff PPE. So always remember, the inside part of our PPE, those are considered as clean parts, while the outside or the front part of our PPE, those are the contaminated parts of our PPE. And before leaving the patient room or cubicle, remove and discard our PPE. Now, depending on the type of isolation case or precautions that you are going to apply to a certain patient, especially for droplet or airborne, all PPE should be removed inside the patient room except for your mask or your N95 respirators. We have different types of personal protective equipment. First is we have your gloves. Now, you need to wear gloves when it can be reasonably anticipated that contact with blood or body fluids or other potentially infectious materials, mucous membranes, non-intact skin, or potentially contaminated intact skin could occur. So you need to wear your gloves. Now, as during my rounds, I can observe that some of the staff, especially if they will just be taking vital signs, they will be transporting patient to OR through wheelchair or stretcher. Most of them are still wearing gloves, which is, I think it's not reasonable to wear gloves. And it's a waste of resources. So, as what I have mentioned, wear only if you will be anticipating exposure to any blood or body fluids or any potentially infectious materials to certain activities that you will be doing to your patient. Next is we have your gowns. Now, you need to wear a gown that is appropriate to the task to protect skin and prevent soiling or contamination of clothing during procedures and patient care activities when contact with blood, body fluids, secretions or excretions is anticipated. Next is we have your mouth, nose, or eye protection. So, you need to wear your mask. So, all of us are wearing masks even though we are not performing any patient care activities because it's mandatory here in the kingdom due to COVID-19 pandemic. So, wear PPE that will protect your mouth, nose, and eyes. So, depending on the possible exposure that you will be encountering, wear face shield or goggles, mask to cover your eyes, mouth, and nose in cases that you will be handling or doing procedures that involves aerosols, splashes of blood or body fluids. The third component of our standard precaution is we have your respiratory hygiene or cough etiquette. Now, this poster, usually you can see that one in most of the corridors of the hospital in waiting areas, so that it is a reminder that healthcare workers, visitors, as well as patients should observe respiratory hygiene or cough etiquette. Your respiratory hygiene or cough etiquette is a important source control measure to contain respiratory secretions to prevent droplet and fomite transmission of respiratory pathogens, especially during seasonal outbreaks of viral respiratory tract infection like your influenza, RSV, adenovirus, parainfluenza, especially in the healthcare setting, and prevention also of our COVID-19 transmission. Respiratory hygiene and cough etiquette, we usually practice that one also in when we are going to triage patient. Those pre-pandemic situation, those patients or visitors who came to the hospital with respiratory symptoms, we usually offer them with masks and let them do hand hygiene. And to always update or to keep our visitors, our patients, to always perform or adhere to respiratory hygiene or cough etiquette, we have signages or posters posted in waiting areas, in our elevators, where most people will stay, so that they will be reminded to adhere to respiratory hygiene or cough etiquette. This component of our standard precaution, we need also to provide things necessary for the implementation for respiratory hygiene and cough etiquette, that is provide tissue or no touch receptacles, especially in waiting areas where most of the people stay while waiting for their turn for consultation. So you don't know what are the cases of those people or clients. So we need to help them adhere to respiratory hygiene or cough etiquette. The fourth component of our standard precaution is we have your patient placement. In deciding where to place our patient, it is very important to include the potential for transmission of a certain infectious agents. So we need to place patients who pose a risk for transmission to others, like uncontained secretions, excretions or wound drainage, infants with suspected viral respiratory or gastrointestinal infections, in a single patient room when available. The following principles should be determined in patient placement. First is we have the route of transmission of the known or suspected infectious agent. Second is risk factors for transmission in the infected patient. Third is risk factors for adverse outcomes resulting from a healthcare-associated infection in other patients in the area or room being considered for patient placement, availability of single patient rooms, and patient options for room sharing. We can also cohort patient provided that these patients have same infectious agent. So we can cohort them as long as there is no other existing disease or infectious agent that the other patient is having. The fifth one is we have your patient care equipment and instruments or devices. So it is a must to clean all patient care equipment, instruments, and devices prior to sterilization, decontamination, or disinfection. And it is also important to wear PPE like gloves or gown according to the level of anticipated contamination when handling patient care equipment and instruments or devices that is visibly soiled or may have been in contact with blood or body fluids. Sixth on our list is we have the care of the environment. So clean and disinfect surfaces that is likely to be contaminated with pathogens, including those that are in close proximity to the patient, like the bed rails, overbed tables, and frequently touched surfaces in the patient care environment, like your light switches, doorknobs, surfaces in and surrounding toilets in patients' rooms, on a more frequent schedule compared to that for other surfaces like your horizontal surfaces in waiting areas. So clean frequently, those are commonly touched or frequently touched by the patients or any other people, visitors or sitters. And one thing that we need to consider for our disinfecting surfaces is it should be EPA registered disinfectants that have a biocidal activity against the pathogens most likely to contaminate the patient care environment. The seventh component of our standard precaution is we have your textiles and laundry. Now, it is important to handle used textiles and fabrics with minimum agitation to avoid contamination of air, surfaces, and persons. There was a memo in infection in the department that if we are going to remove bed linens or any linens from our patient and transport it in the laundry bag, we need to put it first. After removing the linens from the patient, we need to put it in a blue or black bag depending on the quantity of our linens before we transport it to the laundry bag. And when we talk about minimum agitation, let's say for example, if you're going to perform bed making or remove patient's bed, do not let the linen do like that, okay? As much as possible, take it slowly so that you will not contaminate the air in the patient's room. The next one is we have your safe injection practices. Now, these are the following practices that we need to follow in order to promote safety if we are going to administer medications during injection to our patient. First is use aseptic technique to avoid contamination of sterile injection equipment. Second, do not administer medications from a syringe to a multiple patients, even if the needle or cannula on the syringe is changed. Needles, cannula, and syringes are sterile, single-use items. They should not be reused for another patient nor to access a medication or solution that might be used for a subsequent patient. Use fluid infusion and administration sets like your intravenous bag, tubing, and connectors for one patient only and dispose appropriately after use. Consider a syringe or needle or cannula contaminated once it has been used to enter or connect to a patient's intravenous infusion bag or administration set. Use a single-dose vials for parenteral medications whenever possible. And do not administer medication from single-dose vials or ampules to multiple patients or combine leftover contents for later use. If multi-dose vials must be used, both the needle or cannula and syringe used to access the multi-dose vial must be sterile. Do not keep multi-dose vials in the immediate patient treatment area and store in accordance with the manufacturer's recommendation. Discard if sterility is compromised or questionable. Lastly, do not use bags or bottles of intravenous solution as a common source of supply for multiple patients. You need to use your single-use or 10 cc prepared sterile solution or saline solution for dilution of your medication. Second to the last is we have infection control practices for special lumbar puncture procedures. Now, healthcare workers should wear a surgical mask when placing a catheter or injecting material into the spinal canal or subdural space, like during myelograms, lumbar punctures, and spinal or epidural anesthesia. So, surgical mask is very important. Last on the component of our standard precaution is the worker safety. So, I think as a healthcare worker, one of our priority also is to protect ourselves. So especially if we have from exposure to blood or bloodborne pathogens. As part of our employee health program, we are giving vaccinations to healthcare workers who are not immune, especially to hepatitis B. We have a screening program and testing for those newly hired employees and for those who have been exposed to blood or body fluids. So that is part of the program for the safety of our employees. So those are the components of our standard precautions. I mentioned 10. We have your hand hygiene, personal protective equipment. What else? We also have your respiratory hygiene or cough etiquette, patient placement, patient care equipment and instruments or devices, care of the environment, textiles and laundry, safe injection practices. We also have your infection control practices for special lumbar puncture procedures. And lastly is we have your worker safety. I hope that you have learned something out of the lecture that we discussed for this week. And always keep in mind the components of your standard precautions because these are very important. These are your minimum infection control protocols or guidelines for us to be protected, especially in the delivery of care to our patients. So if you have any questions, just write the questions on the next item of this form. And I hope to see you again next week for another topic. Thank you and God bless.